Hi there, Mr. Jim. My name is Grace, and today I will be going over a few lab values with you that were ordered by your provider. So it looks like they ordered a liver panel. These tests are going to test your liver function. If you have any questions, don't hesitate to ask. I also have a handout for you to take home. This is to help you understand the test you're about to receive and to look back for pre and post care. Okay, so let's start with the AST test. This test was ordered to detect tissue damage in your liver, heart, muscles, kidneys, etc. The normal range for this test is 10 to 40 units per liter. If your levels are increased, you're probably feeling fatigued, nauseated, or you could have jaundice, which is yellowing of the eyes or the skin. If your levels are too low, symptoms are rare, but you may experience muscle weakness, fatigue, and difficulty with metabolizing protein. Before this test, we ask that you avoid strenuous exercise and muscle trauma due to injections. This test requires 3 punctures, 1 at admission and 1 each day for the next 2 days. There are no food or fluid restrictions, and there may be some slight discomfort from the needle puncture. During this test, I will be collecting 4 milliliters per puncture after the test. After the test, I will apply direct pressure until the bleeding stops to prevent excessive bleeding. So the next test is going to be the ALT test. This test is used to detect and evaluate treatment of acute hepatic disease, which pretty much just means quickly onset liver disease. This will tell us a little more about your liver than the AST test will. Normal ranges for this are also 10 to 40 units per liter. Increased level symptoms would be jaundice, loss of appetite, and dark-colored urine. And then if your levels are low, you would be fatigued, you'd have some generalized weakness, and some subtle signs of nutritional deficiencies. Before this test, we ask that you avoid any barbiturates, aspirin, or Tylenol, or any opioids like codeine or morphine. This will require a blood sample, and there may be a slight discomfort from the needle. There's no dietary restrictions, and I will be collecting 4 milliliters of blood. After, I will place pressure under the site to avoid bleeding, and then after this test, you may resume all medications you discontinued prior to the test. If there are any abnormal findings, we will report them to you and provider and give you further education on your treatment. So next we have albumin. This was ordered because this test will tell us your nutritional and liver status, and it can tell us whether your body is absorbing enough protein or not. So the normal range is 3.5 to 5 grams per deciliter. Some increased level symptoms would be dry mouth, dehydration, and thirst, and then if your levels were too low, you'd have some edema, poor wound healing, like if you got a cut, it didn't heal right away, and fatigue. If we find any abnormal levels, we will report to our provider and prepare to administer IV fluids to restore value electrolytes with elevated levels. Some things you want to avoid before this test are things like penicillin, aspirin, and prolonged bed rest. Before this test, there are no dietary implications. This test does require a blood sample, so will be collecting 5 to 10 milliliters in a tube. After I do that, I will apply pressure to the puncture site until the bleeding stops, and if your levels are low, I will encourage a high protein diet. Next, we have alkaline phosphatase, which is the ALP test. This will help check for liver and bone disorders. Normal ranges are 50 to 120 international units per liter. Increased level symptoms would be jaundice, bone pain, and itchy skin, and some decreased level symptoms are numbness or tingling. If we find any abnormal levels, we will report them to your healthcare provider and educate you about any diseases and possible treatment options. Before this test, we ask you to avoid ingestion of extra vitamin D and to avoid fatty meals. Please fast for 8 hours before this test because the fat intake can stimulate ALP secretion during the test. Fasting is just no food or drinks. I will puncture and collect a 4 milliliter sample. After the test, I'll apply pressure, and you can continue your usual diet. So next, we have direct bilirubin. This is checking for bile duct blockages, which are kind of rare, but it's good to know. Normal ranges are 0 to 0.5 milligrams per deciliter. Some increased level symptoms would be jaundice, dark urine, a pale stool, and some decreased level symptoms are none because it's so rare. If we have any abnormal findings, we will prepare you for additional testing. Prior to the test, try to avoid barbiturates and hemolytic agents. This test does require a blood sample, and you should fast for at least 4 hours before the test. I will be collecting a 3 or 4 milliliter tube, and then I will apply pressure to the puncture site until the bleeding stops. Next, we have total bilirubin. Why is this test ordered? To assess liver function. Normal ranges are 0.1 to 1.0 milligrams per deciliter. Some increased level symptoms are jaundice, itchy skin, and fatigue. In decreased level symptoms, there's often none. We're going to ask that you fast for 4 hours before the test. During this test, I will collect a 4 milliliter sample, and after that, I will apply direct pressure to the puncture site to avoid excess bleeding. And then lastly, we have total protein. This is ordered to test for your nutritional status, and it can sometimes tell us if there's a chronic illness going on. Normal ranges are 6.0 to 8.3 grams per deciliter. Some increased level symptoms are fatigue, dehydration, and joint stiffness, and some decreased level symptoms are edema, muscle wasting, and brittle hair and nails. If we have any abnormal findings, we'll report to your provider and educate you about the diagnosis. During the test, I will puncture and collect a 7 milliliter sample, and then I will apply pressure to the puncture site until the bleeding stops. After this test, you can resume all medications that were discontinued before the test. Okay, if you have any questions, don't hesitate to ask.